Hi, my name is Dr. Adam Tan, and I'm the clinical director at Georgia Dental. We are seeing emergency patients during the COVID-19 outbreak, and you have immediate access to scheduling with any of our doctors for an emergency online consultation. So today, um, the question is masks. Should I wear masks? And we know a lot more about COVID-19, and we realize that most of the transmission is through touching contaminated surfaces and then touching your mouth, your ears, and your nose or your men. So don't touch your men. And the key thing is in breaking this um, uh, transmission, it's a matter of breaking that habit. Okay, so 2 points on this. The first thing is always follow Public Health Ontario recommendations and your local health unit, because the local containment strategy for communicable diseases like COVID-19 really depends on a multitude of factors, including the robustness of the personal protective equipment supply chain. So where we are, for example, we are we are conserving what PPE that we have. Just to give you an idea, we've placed an order several weeks ago for personal protective equipment, and we don't have a defined delivery date for it. Okay, so there is a shortage for it. The second point is, if you're going to go out, and here's the important distinction: you have to and you should wear some form of a face guard. It doesn't have to be a surgical mask. It doesn't have to be one of these surgical masks. Okay, there's tons and tons of videos on YouTube on how to train yourself to break that connection and wear a surgical a mask or a homemade mask. So again, it's about breaking that connection between your contact with contaminated surfaces and then touching your mouth, your eyes, and your nose. So one of the additional barriers to this is to carry a bottle of hand sanitizer. So once you go out, if you're touching shopping cart handles, if you're opening doorknobs, or if you're touching buttons or pressing buttons, just clean your hands immediately after doing so, and then don't touch your face. Okay, so think about having some form of a face guard instead of wearing a surgical mask, and you're going to be okay. So look, if the frontline workers are conserving them anyway to using a single mask for an entire day, and they're only changing it when it's soiled, you most certainly can do that too at home. Okay, so if you have a reusable mask that you've made yourself, hang them up in the sun, sanitize it. As long as it's not soiled, you're okay to use it. Again, the thinking here is it's a face guard to break that connection between contaminated fingers and your mouth, eyes, and your nose. Okay, so think about it. It's to the point where we're now seeing reports of counterfeit N95 masks. It's getting crazy, right? So here it is. The point is, you're getting information. Knowledge is power against fear. You're going to be okay. We're going to be here for you. I want you to stay healthy, keep safe, and we'll see you soon.